an animal scanner. It was done at 1.5 Tesla, which at the time was the most common clinical scanner and still is today for use for cardiac MR and other MRI. Now, a lot of people can use a wide variety of molecules to home particles. You can use aptamers, you can use antibodies, you can use peptides. In this particular case, we're using what's called the peptidomimetic. It's a mimic of an RGD peptide. And this particular mimetic is very specific for alpha V beta 3, actually in the activated form, 20-to-1. So it doesn't really bind alpha B beta 5, it doesn't bind alpha 2 B beta 3 or any of the other platelets. And by itself it has a binding of around less than 10 nanomolars. But when you put it on the particle, maybe 300 or 400 copies is all we use. You bring the binding of the particle down to around 50 picomolar. That's essentially stick and stay, 50 picomolar. Now, one of the things that's important to know about these agents is whether they go where you think they're going. And we spent a lot of time in competition studies and others I'll show you. But here I just want to point out, here's a Matrigel plug, which has FGF in it, which is driving angiogenesis. And if you look at this red blocks here, this is an angiogenic-rich area. And this area here on the skin has other microvessels. So here in the red blocks going across the top, you can see rhodamine-labeled particles right along here. And if you look at this area here, we don't see any particles. If you look for PCAM, which stands for endothelium, both mature and immature endothelium, well, let me put it this way, endothelium of mature and immature vessels, you can see the green here along the line, which follows this line, for the particle.